Hi, my name is Kat, and today I'm going to be talking about today's most urgent public health crisis for the consideration of policymakers, which I believe is antimicrobial resistance. So, what is antimicrobial resistance and why does it matter? Basically, it's when bacteria, fungi, parasites, and viruses no longer respond to treatment. Microorganisms resistant to treatment are often called superbugs. An AMR can increase disease spread, severe illness, and death. Medicine becomes ineffective, and the initial infection persists. So, what are the implications of AMR? Basically, microorganisms know no bounds. We are all affected by antimicrobial resistance. As of today, an estimated 1.2 million deaths can be directly attributed to AMR, and in conjunction with other diseases, it can be as high as 5 million. It is also exacerbated by socioeconomic status, so low middle income countries suffering from poverty and inequality. We see this the most in those countries, and it's extremely costly. It can add nearly 1 trillion to healthcare costs by 2050. When we talk about AMR, what happens is diseases that are not normally deadly can become very deadly as a result. So one of the most common diseases people get in hospitals are C. diff and MRSA. And C. diff is a bacteria that can cause deadly diarrhea, and of 3 million infections in a year, 48,000 can result in deaths directly attributed to antimicrobial infection. And MRSA is can cause sepsis or death. Sepsis is an infection of the blood. And MDR-TB, while TB is not extremely prevalent in the United States, it is still extremely prevalent in low middle income countries. The bacterium causing TB has become increasingly drug resistant over the years, and the medication itself is extremely expensive. So, when we're constantly trying to come up with new medicines and microorganisms are constantly changing, this can become a severe public health threat for all. In conclusion, AMR is a global public health crisis as new resistant strains of existing pathogens emerge, so I urge policymakers to consider the urgency and impact AMR poses to global populations. Thank you.